Pressure ulcer. What is it? Where does it come from? It's a wound that's caused by constant unrelieved pressure to the skin and underlying tissue. The pressure comes from outside the body, and the pressure slows the blood to an area which leads to tissue death. The skin is the human body's largest organ. The skin is the body's first line of defense. The functions include protection, regulation, sensation, and metabolism. Where are they? Pressure ulcers form over the bony prominences of the body. Stage to a pressure ulcer is the grade to indicate the amount of tissue damage. They range from stage 1 through 4. And there's also suspected deep tissue injury and unstageable wounds. Those two can't be appropriately assessed to assign a stage. So who is at risk for pressure ulcer? Patients with poor nutrition and immobility, those with an inability to feel and report pain, because when pressure ulcers are developing and present, they are painful. Those with lowered mental awareness. Just one risk factor puts a patient at jeopardy of developing a pressure ulcer. Head to toe. We need to check the skin head to toe. Every time you perform patient care, you have the opportunity to assess the skin. Areas of redness which fade when touched and released is known as the wound being blanchable, or area being blanchable. It's not a wound at that point. But redness may be present and not fade when the skin is touched and released, and this is referred to as unblanchable. The blanchable areas are not pressure ulcers, but remember to relieve the pressure to those points to prevent any pressure ulcer injury. Pressure ulcers are found over bony prominences, such as the sacrum, heels, and elbows. Check the skin every shift for at-risk patients. Clean and dry skin should be maintained. The goal is to reduce or stop pressure ulcer development. Prevention is key. Encourage fruit, vegetables, and proteins. Feed patients unable to feed themselves. A dietary consult should be provided to assess nutritional needs. Encourage PO fluids to maintain skin integrity. And positioning and repositioning. Encourage patients to shift positions. Turn and position patients unable to do so themselves and use a turning schedule. Keep the head of bed 30 degrees or less to prevent friction and shear, and float heels with pillows. Let's take the pressure off. We have the opportunity to offer our patients optimal health in the prevention of pressure ulcers.